Alright, welcome back. Okay, so I didn't record, I didn't record the time of my last video. So this video I'll record the time, probably around about 30 minutes. Okay, so the first disorder would be, class of disorders rather, would be the anxiety disorder, which anxiety is the predominant feature. Makes sense. Phobic disorders is one type. It is characterized by marked, persistent, and excessive fear and avoidance of specific objects, activities, or situations. It is an irrational fear that markedly interferes with an individual's ability to function. 12% of the people in the US will develop a specific phobia during their lives. You can check out this link, phobia list, for all the various types of phobia. So the preparatedness theory of phobias maintains that people are instinctively predisposed towards certain fears. Certain animals, such as snakes and spiders, natural environments such as heights, darkness, water, and storms, situations, bridges, elevators, tunnels, enclosed spaces, blood, injections and injury. Other phobias include such as choking or vomiting, loud noises or costume characters, such as fear of clowns. Pretty much anything that could potentially cause harm, physical or psychological, can become a phobia. Even pickles. This is video of a individual who has a phobia of pickles. And she goes on to show Maury, and Maury is horrible person because of what he essentially makes her confront her fear of pickles. So it's a good video to watch. Shows how Maury is evil and sadistic. So social phobia is another phobia. It's an irrational fear of being publicly humiliated or embarrassed. As you remember from our lecture on social psychology, being social is important to us. It's very important to fit in society. It deals with our ability to survive. So social phobia is working on that fear, that need to fit into our social circles, and we have a fear of being ousted from that social circle through humiliation or embarrassment. It generally emerges between early adolescence and early adulthood. Many people experience social phobia, with about 12% of men and 14% of women who qualify for a diagnosis at some time in their lives. So this diagnosis is different from your fear of public speaking. It won't be as bad. You have a fear of public speaking, but you'll do it anyways if you had to. But a phobia is to the extent that it is extremely difficult, and you would rather do anything else and avoid any public situations. So this is just a funny picture. Walk up to the club, like what? I have social anxiety and I want to go home. Yeah, so if you have social anxiety, it's difficult for you to be out in public places. So moving on to the treatment of this problem. Behavioral therapy is one form of treatment. Behavioral therapy assumes that the disordered behavior is learned, and that symptom relief is achieved through changing overt maladaptive behaviors into more constructive behaviors. So this is from your Watson and Skinner on stimulus learning and behavioral learning. So the same idea applies here. So eliminating promoting behavior can be influenced by its consequences. So reinforcement, punishment. You guys remember that? Token economy is used as a form of therapy in which clients receive tokens for their desired behaviors, and this can be traded for later rewards. In one rehab center that my friend was in long ago, he asked us to bring him batteries when we visited, and so batteries were a token. We couldn't give him the batteries directly. Um, they had to be checked in at the front. So I did ask the nurse that checked this in, why batteries, and she was like, "Oh, it's used for various devices." So in that the rehab center, batteries can be considered a token. Um, Exposure therapy is one way to deal with a lot of emotion arousing disorders. You confront the stimulus directly and repeatedly, and to ultimately leading to a decrease in the emotional response. If you guys remember habituation and response extinction, uh, so you have a great fear of something, and you are slowly exposed to it. The idea is that you are eliminating the death fear. So you have a fear of something that most likely is tied to the idea that you're gonna die if you confront it. So by confronting it slowly in small amounts, you get used to, you get adjusted or habituated to responding to the fear stimulus. So once, okay, I don't know if you guys picked up on the background noise, but I just closed the door. So this is exposure hierarchy for social phobia. So the lowest is ask directions for the gas station. This is specific to social phobia, but the idea is that you increased your scale, your fear scale, through each of these items, and as you are able to accomplish these tasks, you overcome your fear of social situations. So for instance, this ask directions at the gas station. So this fear count would be worked out between the patient and the client. I mean the therapist and the client. And so list a bunch of things and how fearful they are, and start from the bottom to get over your phobia. Cognitive therapy is another way to address this. It focuses on helping a client identify and correct any distorted thinking about themselves, others, or the world. It emphasizes their interpretation of the event. So, I guess this is common irrational beliefs and emotional responses they can cause. I have to get this done immediately. If you have a belief that you need to do things immediately, you can cognitively rephrase that so that it reduces your anxiety and stress. The idea that everyone's watching me, the spotlight effect. In truth, most people are not watching you most of the time. Even as a lecturer, I see that you guys are not watching me all the time. So that is a cognitive reappraisal. And more severe ones are I'm a loser and I will always be a loser, lower self-esteem. So cognitive therapy will address that by helping the person think about positive points of life, positive views of themselves, or just a more realistic view of themselves and others. So you remember from the self-esteem content that self-esteem is based on who we compare ourselves to. So if we change that comparison, you might think you're a loser compared to a celebrity, but if we change your comparison point, you would improve on that. So that's one way to cognitively adjust for a low self-esteem. So that's cognitive restructuring. Teaching clients to question the automatic beliefs, assumptions, and predictions that often lead to negative emotions, and replace negative thinking with more realistic and positive beliefs. Identifying evidence that supports and fails to support each negative thought. To generate balanced thoughts that reflect the true state of affairs. The idea is to remove the dark lens that patients have with clear glass. So, if possible, give them a more positive view of life, but most likely We want a realistic view of life that's in contrast from the humanistic person-centered approach. One method is mindful meditation, teaching an individual to be fully present in each moment, to be aware of his or her thoughts and feelings and sensations, and to detect symptoms before they become a problem. So if you have a negative cycle of sadness or anger, mindful meditation will help you confront that and address that you're starting to feel this way and what to do about it. Cognitive behavioral therapy, or CBT, is the best of both, a blend of cognitive and behavioral strategies. It is problem focused, means that it is undertaken for specific problems, so you have to identify a barrier in your life, and CBT presents both thoughts and behaviors to change or overcome that barrier. So action-oriented, the therapist tries to assist the client in selecting specific strategies to help address those problems. The client is expected to do things such as engage in exposure exercises, practice behavioral change skills, or use a diary to monitor relevant symptoms. So this is more of a, if you want to overcome social phobia, again, the therapist would tell you to both work on mindful meditation, think about being aware of what thoughts are going through your mind as you approach a social situation, but you're also engaging in behavioral conditions such as approaching a social situation. So you have the behavioral component as having to do the behavior, engaging the behavior, and you have the cognitive component where you're also being aware of the thoughts that are coming as you engage in behavior. It is transparent, so nothing is withheld from the client. So this is just telling the client a lot of information about what they are expected to feel, and what the behavioral consequences of their actions are. So that's how you address some phobias. Panic and anxiety attacks is another. It's a symptom of anxiety disorders. This is a description. The attacks begin with a sudden wave of intense, terrifying fear that seemed to come out of nowhere, often accompanied by dizziness, a tightening of the chest, and the thought that he was going to die, going to pass out, or possibly die. So this is your description of a panic attack. How many of you have had a panic attack before? My panic attack, the only one I've had so far, was in high school, and it was after the second time I failed my driving test. The first time I should have passed, but I did not look back on reversing, which was a critical maneuver. And so I had a lot of anxiety on the second attempt. Basically failed before I left the parking lot. Said no to the instructor because I thought you weren't supposed to turn left at a certain point on the exit of the parking lot. So after that, I was just worried that I wouldn't pass my third test. So that led to a short panic attack, accompanied by feeling like you couldn't breathe. Basically, I had to lay down on the ground and kind of suffer through it until the feeling went away. So 22% of the U.S. population reports having had at least one panic attack, typically during a period of intense stress. So college might lead to an increased probability that you might suffer from a panic attack, especially during, I guess, finals or a big test. A panic disorder is characterized by the sudden occurrence in multiple psychological and physical symptoms that contribute to the feeling of terror. A person has a panic disorder only if they experience recurrent and unexpected attacks and report significant anxiety about having another attack. So when your panic attacks come often and you have great fear of experiencing the next one, that you are suffering from a panic disorder. Approximately 5% of people who have a diagnosable panic disorder sometime in their lives. So that is, people who experience panic attacks may be hypersensitive to physiological signs of anxiety, which they interpret as having disastrous consequences for their well-being. So this is going back to the idea of the predisposition of certain people to have disorders. So if you're hypersensitive to your physiological signs of anxiety, you might think really badly of them, which leads to a panic attack. Generalized anxiety disorder. Agoraphobia shouldn't be here. Just came out of nowhere, but it's the fear of public places, which is different from generalized anxiety disorder, because the unrelenting worries are not focused on any particular threat. So agoraphobia, fear of public places, the patients generally are characterized by a hermit behavior. They're afraid to go outside because they're fearful of public places. But generalized anxiety disorder is just not focused on any particular threat. So it's not that you're afraid of going out or something like that. It's that you just generally are and chronic, excessively worried, with symptoms of restlessness, fatigue, concentration problems, irritability, muscle tension, and sleep disturbance. So just being worried in general and having anxiety. Approximately 6% of people in the U.S. suffer from GAD at some time in their lives. So, generalized anxiety disorder, a funny comic. I can't shake this feeling of dread, and we can see this hammer approaching them. So, sorry, to clarify, that's how you feel. You just have a general anxiety. So in contrast to this one, where there is a specific anxiety-causing object, this would be that you wouldn't see the object and just have a general feeling. Ways to deal with the anxiety disorders is using one way, or rather, the biological way is to use anti-anxiety medication. One class is the benzodiazepines, a tranquilizer that works by facilitating GABA, which is an inhibitory neurotransmitter. So anxiety disorders are characterized by an over response to physiological arousal. So GABA works by inhibiting that arousal. Some other names are Valium, Ativan, and Xanax. Are common drugs that people take. I'm more familiar with Valiums and Xanax, Xannies. Typically, they take effect in a matter of minutes, and are effective for reducing symptoms of anxiety disorders. So these drugs are probably quite common among recreational drug use as well as academia. What are some anxiety-provoking events within academia? Some would be giving a presentation or public speaking. So this causes a lot of anxiety among people for fear of public speaking and shame. So one idea is that people would take some anti-anxiety medication prior to the speaking event, and that would help them be more calm during the speaking event, making it a less strenuous process. Anti-anxiety medications suffer from drug tolerance, the need for high doses over time, so they can be habit forming. So people have difficulty coming off the drugs as well, because discontinuing the medication has withdrawal symptoms, which is characterized by one withdrawal symptom is anxiety. So in order to get well from taking anti-anxiety medicines, you have to reduce the dosage. So the idea is You can take anti-anxiety medicines, but you also have to work on your cognitive or behavioral modifications as well, or else you will become dependent on them, and generally the medications become the new problem. So they help to reduce anxiety, but you should work on being naturally able to reduce anxiety through other additional therapy. Anxiety can also cause insomnia, so hypnotics are maybe useful as sleep aids, such as Ambien. If you guys have heard or seen commercials for that, it's in wide use and it's also effective, but with some side effects of sleepwalking, sleep eating, and even sleep driving. I haven't heard of this one, Buspar, but it reduces anxiety among individuals who suffer from generalized anxiety disorder. So those are some treatments for this anxiety class of disorders. Yeah, so panic disorder symptoms. So as you can see here, this is the medication. This is a placebo. So as you can see, placebos have a really high effective rate. So just, if you have an excessive worry, just having a medication that you perceive to have an effect of reducing that excessive worry has an effect of actually reducing it. But real medicine alone is also able to address it even more. And cognitive behavioral therapy alone is effective in reducing panic disorders. But using both the medication and the therapy has a really high effective rate, but still not great. It's only at 63%. We're hoping at an even higher rate, but not all treatment is effective, as you can see here. Yeah, so this is just showing that the drugs can help, but they also activate different parts of the brain, which isn't as good as just using the behavioral natural modifications. But the idea is that both similar parts of the brains are activated when we seek these treatments. So combining them would be more effective. Generally, you need biomedical treatment for more severe cases of the disorder. So moving on to the next disorder, obsessive compulsive disorder, OCD, in which repetitive intrusive thoughts, obsessions, and ritualistic behaviors, compulsions, are designed to fend off thoughts, interfere significantly with an individual's functioning. So OCD gets thrown around more often than others. Some we might say a roommate is OCD about being clean or certain things. So have you used it to characterize yourself or others? You might have some stories where you call someone OCD about certain things. This video should work. It's might not work. You might have to try to find the link to it. Just search a video on YouTube for OCD. It was about a celebrity that has OCD, and their OCD was cleanliness. So they would try to avoid shaking hands with the contestants and other guests. So it shows that OCD, people with OCD can function generally normal situations with some compulsions, behaviors. So it wasn't as bad, but one OCD example is that you have to say something 7 times, or you have to check something 7 times before you feel that it's complete. So that's a compulsion. Okay, so it looks like that video does work. So 28% of adults in the US report experiencing obsessions or compulsions at some point in their lives. Only 2% will develop actual OCD. Checking is the most common type of OCD, 79%. Ordering, 57%. If you feel the need to order things that are misplaced or out of organized a certain way, then you have an ordering disorder. So that's like the need to alphabetize things or organize things by colors. Moral concerns is 43%, and contamination is 26%. So treatment of OCD involves exposure and response prevention, ERP, in which people are gradually exposed to the content of their obsessions and prevented from engaging in their compulsions. So if you're obsessed with cleanliness, you'll be exposed to something dirty, and you won't be allowed to like clean your hands. So that's one of the ways of exposure and response prevention. Another way is psychosurgery, which is not as good. That it's surgical destruction of specific brain areas. It may be used to treat psychological disorders, such as so psychosurgery is equivalent to a lobotomy in severe cases of OCD, in which the person is completely unable to function. And medication as well as psychological treatment is not effective, then we might have to fall back on psychosurgery. One common psychosurgery is to cut the corpus callosum, which is the connecting between the two brains. So you have to remember the split brain conditions. That's one result. Another is deep brain stimulation, which combines the use of psychosurgery and the use of electric circuits. PTSD, post-traumatic stress disorder, is characterized by chronic physiological arousal, recurrent unwanted thoughts or images of the trauma, and avoidance of things that call the traumatic event to mind. So approximately 12% of U.S. veterans of recent operations in Iraq meet the criteria for PTSD. Observed rates of PTSD are even higher in non-Western and developing countries. Why do you think that might be the case? Because of their greater conflicts within those countries. There could be great conflicts such as genocide in certain African regions. So that would definitely cause you some PTSD if someone is trying to wipe out your entire race. So about 7% of Americans are estimated to suffer from PTSD. Another disorder that's not covered in your book, at least I didn't see it prominently, is the dissociative disorders. They are one characteristic of this disorder is that the cognitive processes are severely disjointed or fragmented. The sufferer has disruptions in memory, awareness, and personality. So in the United States of Tara, basically she's suffering from a multiple personality disorder and has fragmented personalities of herself, which it has its own specific awareness and memory. Dissociative amnesia is a sudden loss of memory for personal information. Sometimes this is shown in a lot of movies or dramas where the person just can't remember who they are after a certain traumatic event. Dissociative fugue is a sudden loss of memory and assumption of new identity in new location. So this is when someone goes out for a walk and just disappears. They just experience a trip and show up somewhere else, not aware of who they are, and just create a new life in a new area. So there's generally some cases of this is just people who are under a lot of stress in family situations, and they just disappear. They go for a drive, go for a walk, and just disappear. End up in some states, in another state with a new family and not aware of their previous identity. So a complete dissociation from their previous identity. As mentioned just earlier, dissociative identity disorder, or multiple personality disorder, when two or more distinct identities take control of behavior. So some movies related to this is Sybil and The Three Faces of Eve. These are great psychological movies on this crazy disorder.
The lady fighting an everyday battle from within. Paula Hanlon has...
Okay, so that video kicked in by itself, but this lady has 90 personalities, which is really bad because it's a result of a clinician doing the wrong thing and splitting her identities so much. This is one of the issues with psychotherapy, is that you can suggest certain things to the client, and the reason why dissociative identity disorder is not so prominent in the DSM-5 is that one of the reasons is that there's a belief that it's suggested by certain clinicians just because they like just so. So 90 personality disorder. So who characterizes that person? The therapist, by identifying different with the same suggestibility paradigm. So if you suggest to someone they are someone else, each time they change a little, they can have fragmented personalities due to the interaction between the therapist and themselves. So it's more likely someone has less than 10 personalities rather than as many as 90 personalities.
90 different.
Okay. So dissociative disorders generally occur because of experience of the patient experiencing events they would like to forget. So they are skilled at self-hypnosis, and it's generally escape from extreme trauma or abuse. So being able to compartmentalize yourself, or hypnosising, putting yourself into a hypnosis as another person who experiences the trauma. So this disorder occurs with severe abuse as a way to protect the ego of the patient. So a modern movie is Leonardo DiCaprio is Shutter Island. If you watch it, I won't spoil it for you, but it's considered a case of DIAD. So we'll take a break here.